Greetings and thanks once again for spending a few minutes to hear what's going on at FHN. Today I'm joined by two guests, and we have Sean Huguenin, who is our spiritual care coordinator. We'll be talking a little bit about safety and our spiritual and mental well-being. So I hope that you enjoy hearing from Sean. Sean's been with the organization for a number of years and has been spearheading a lot of our spiritual care coordination with other pastors and chaplaincy throughout our area. So I'm excited that Sean's going to get a chance to share with you. And then we have Dr. Eric Auwender, who is our medical director for our emergency department. And Dr. Auwender has been taking care of families in this community for over 20 years, 22 years in fact. And so we're really excited about you getting to hear exactly from Dr. Auwender some advice on things for you to look out for, what's going on within our emergency department, and more importantly, knowing that we're here for you when you need us.
Well, one of the biggest things that I see as a challenge today is the unrest in our society. And unrest in the human body plays a huge effect not only on our spirituality but also on our physicalness. When we have unrest, we also have stress in our bodies, anxiety in our bodies. As we know, that pays a severe toll on our physicalness as well. With unrest today, with the things going on, is this spiritually we struggle with the things such as powerlessness, hopelessness. We don't feel like we have any control over what's going on, and we as humans like to have control, and when we don't, that really causes a lot of unrest in us. So I see that being a huge problem with our spirituality battles that most people are having today. Well, to do the things that make you feel good. We all have that, what I call happy place inside of us. And it's to go back to that and to realize, one is to love others as we love ourselves, the golden rule we always talk about. But mostly to find those things that bring us joy, that can help you in a time such as this, to acknowledge what you have control over and what you don't have control over. To keep my faith strong, I try to surround myself with people that are like me. Those spiritual mentors in my life, my pastors and stuff, the faith community. It's iron sharpens iron, and times like this, we aren't perfect, and it's to be surrounded by those that we can entrust in to help keep us filled, not only spiritually with our needs and faith-wise with our needs, but also for advisement. So it's kind of finding them good accountability partners in your life to help you in a time such as this. During times like this, it's very hard. It's taking and looking in between the chaos and finding the opportunities that are there. One of the greatest opportunities that I found during a time such as this, where we tend to feel so oppressed, is having a time to spend with those closest to us, our own families. Life has been so busy, and it always is. We find ourselves coming and going, and it's a time like this that we find ourselves being surrounded by those we truly do love, our family, our children, our spouses, our partners, our friends that we can be in contact with. And it's really taken this time to get to maybe know those that we normally haven't had the opportunity. I call it quality time. If anything, during this, it's allowed us quality time. And most of all is to, not always look at our understanding, but to look at everything that's going on and try to say, okay, can I impact in a particular part of this? If I can, what can I do to help out in our society and to make this world a better place for ourselves?
Since the beginning of the pandemic, we have attempted to separate COVID from non-COVID patients. That begins with the intake process at triage, where once we identify a potential COVID patient, they will be placed preferentially in either our negative air pressure isolation room, or if that is unavailable, into one of our single patient rooms. Alternatively, the non-COVID patients are more likely to be placed with other non-COVID patients in some of our multi-patient rooms with curtained partitions in order to limit their exposure. The most common symptoms we've seen related to COVID-19 are respiratory symptoms, and the more severe symptoms are shortness of breath and cough, as well as some general constitutional symptoms, weakness, malaise, fatigue. Some patients have very mild symptoms such as nasal stuffiness, sore throat, headache, muscle aches, and a minority of patients will actually have gastrointestinal symptoms such as nausea and vomiting and diarrhea. Providers and staff in the ER initially were wearing surgical masks at the onset of the pandemic. An example of that is here. These come in different colors. These are not like the cloth masks that are worn by the public, which are really worn to protect others from the mask wearer. These are, of course, medical grade, and these protect the mask wearer from others. Now, more recently, in the emergency department, all staff and providers are wearing N95 masks. And an example of the N95 mask is here. This is a higher grade and more efficient medical grade mask. It blocks out, which is what the N95 stands for, at least 95% of small particles. It also has a much tighter fit and smaller pores to allow for filtration of those particles. And finally, for patients in whom we suspect COVID and we need to do invasive procedures, such as intubations when we place a breathing tube down the windpipe, or nebulizer treatments, which are breathing treatments performed by our respiratory therapists, and which can produce aerosols or vaporized particles in the air. We use these cappers, and this stands for Continuous Air Purifying Respirator. And this is basically a helmet like this, and it comes with a face shield and a neck membrane, which is clicked into the helmet, so it covers the entire face and neck of the wearer. And then this long tube or hose, which is plugged into a battery pack, which is clipped to the waist. And this will deliver a continuous stream of air into the helmet to keep the wearer cool, prevent perspiration, and prevent condensation or fogging of the face shield. They're also called PAPRs, for powered air purifying respirators. And other than that, all patients now are given masks upon arrival in the emergency department. Yes, we have definitely seen that happening. And FHN, along with most hospitals nationwide, outside of the hot zones in the major metropolitan areas, has seen a significant decrease in our patient volumes. And this started around the time of the sheltering at home mandates in mid-March. For an example, our patient volumes pre-COVID were about 75 patients a day in the emergency department. There was a week or two in late March and April where we saw half that patient volume. Now in the past month, we've seen an uptick in our volumes, but they're still only about 2/3 of where we were before this started, so about 50 patients a day. Now, we were not surprised that we were seeing less trauma. We thought that might happen because patients were staying indoors, they weren't out driving, they weren't out participating in sports, and the bars were closed. So that was not surprising. What did surprise us is that we saw a significant decrease in the number of major medical emergencies. And we assumed that people were still having heart attacks and strokes that would not be affected by the shelter-at-home mandate, but patients were simply choosing to remain at home with their symptoms and wait it out rather than coming to the hospital due to the widespread fear and panic of COVID exposure. Some of the implications, to be very blunt about it, are worsening of chronic conditions up to and including death. And as kind of a corollary to what I mentioned in the last answer with us seeing fewer heart attack and stroke patients, there was a period of a couple months where we actually saw triple the amount of patients coming to the emergency department by ambulance in cardiac arrest. So you can't necessarily infer that that's causal, but our assumption is that patients are having their symptoms of a heart attack or a stroke and are preferring to gamble and wait it out at home and hope that they improve by themselves. And in many of these instances, unfortunately, they succumb to their medical issues. These are the same symptoms that should not be ignored at any time. And the major ones would include, of course, what most people would consider emergent symptoms: chest pain, shortness of breath, abdominal pain, severe headaches, neurological symptoms such as difficulty with vision, speech, numbness or weakness of a limb or one side of the body, and then injuries. If a patient thinks they have broken a bone, if they have sustained a cut and they can't control the bleeding or it becomes infected, these are all problems that still need to be evaluated by a healthcare provider, and in some cases that needs to be taken care of in the emergency department. No, it's not necessary to always come to the emergency department. With some of the minor complaints, such as a mild headache, nasal stuffiness, sore throat, simple fever, it's perfectly acceptable for a patient to call their primary care provider and either be seen in their primary care provider's office or sent to the PIC or physician's immediate care. And alternatively, the primary care provider may think that there is something more serious going on or something that needs to be tested and treated in a more timely manner, and they may actually refer the patient to the hospital to be seen in the emergency department. But it's very similar to pre-COVID. You know, use common sense, and not all of these problems need to be seen in the emergency department. When in doubt, call your primary care provider. Well, I think it's important to realize that as things open up across the state and we begin to see normalization of our activities to hopefully our levels pre-COVID, that we not lose track of the big picture and that we don't become complacent. What we don't want to do is see a resurgence or recurrence of the virus because we have become careless. And then we'll either see a return that is sooner or more severe than what could possibly happen in the fall anyway, just with the natural life cycle of these viruses. So it's important to maintain your social distancing whenever possible. Try to avoid large crowds whenever possible. Maintain good hygiene etiquette. If you're coughing and sneezing, do it into your elbow. Don't spray it into the crowd. Wash your hands frequently, especially if you've been in public and you've been touching surfaces. Stay at home if you're sick. And when in doubt, call your primary care provider. There is more testing now, and in fact there are testing centers now for people who are asymptomatic across the state. And don't return to work until you have either been released by a medical provider or are symptom-free. And again, if you are feeling ill, call your healthcare provider. If you're feeling very ill, call 911 or come to the emergency department. So I think the main message is just be aware, be cognizant that we don't want to give up the gains that we have made as far as flattening the curve. We want to avoid any unnecessary deaths or a surge which overwhelms the healthcare system. So continue to be smart out there and stay safe.
What's really heartwarming and rewarding to see is when we've had some of our COVID-19 positive patients that have been critically ill, even on ventilators, be able to be weaned off the ventilators, go through good amounts of respiratory therapy, being well cared for, and eventually walking out of our doors or being able to go home. And so we share and we see those successes each week, and that's really encouraging to watch people getting better and being able to go home. Our COVID-19 cases have been relatively flat, so we still are seeing COVID-19 patients in the hospital. At the time of this recording, we have one patient in our intensive care unit who is not on a ventilator, and we also have 3 other patients in our isolation unit at this time. So a total of 4. Not a huge number of patients, but certainly very important nonetheless, and takes a lot of resources and dedication. We have not been without a COVID-19 patient for quite some time, but the numbers are very low. I think we're all excited about being able to enjoy some of our freedoms and being able to go out and to socialize a little bit more. One of the things that I would again encourage our community to show some caution on is making sure we are following good social distancing guidelines, wearing masks, washing our hands, and being responsible. It's a slippery slope, and I can certainly see the temptation not to wear a mask or to get closer to people and to go back to shaking hands and hugs, some of the things that we miss. However, we are not out of the woods by any means, and COVID-19 is still present in our community. So we should be exercising caution as we do enjoy these new lifting of restrictions. Since the beginning of the pandemic, we've had less than 40 patients in total, and thankfully most of those patients have done very well, and the level of illness has really been across the board. Some patients were significantly ill where they did need to be on ventilators and in our intensive care unit. Others just needed some time in the hospital under the watchful eye of physicians and nurses and being able to go home. So as a community, we've been very fortunate that we have not seen the large volumes that many major metropolitan areas have. National Hospitals Against Violence Day is really a nationwide initiative, and it's sponsored by the American Hospital Association. Those that are interested can visit the American Hospital Association's website to learn more. But it's really a way for hospitals to take a stand together to acknowledge that there is violence out in our community, and we see that day in, unfortunately day out, and it's our responsibility to help to care for those individuals that have been impacted by violence. And so as hospitals see that, it's very frustrating for us that we can't do more, so we strive to do all we can to help those victims, and we really want to raise awareness to try and promote hope. Given the instances that we're seeing across the nation over this past week, I think hospitals can have a calming voice, knowing that we are there to help any and everybody, and making sure that we treat those that are hurt both physically and emotionally, and making sure they have the resources, that people are treated with respect, dignity, and compassion, and that we also, as hospital systems, are role modeling the type of behaviors that we'd want to see throughout our society. So it's a big responsibility for health and hospital systems in really caring for communities and showing our compassion for all of the families that we serve. The appropriate theme for this year's Hospitals Against Violence is Have Hope. And there's nothing more powerful than having hope. That's what gets us through each and every day. As I mentioned, it's a challenge for many of our caregivers to be able to, day in, sometimes day out, deal with people that have been impacted by physical, emotional, or other forms of violence, and be able to continue caring compassionately with skill and being committed to serving every individual in the best way that we can. And that's only possible by having hope. As a community, I would ask for all of us to take a step back, take a breath, and reflect on peaceful ways to create change, and of course, to have hope. FHN's communities are very engaged, and one of the things that's really rewarding is to work for a locally focused healthcare system that is so well connected with the community. And where we look at having hope together is really partnering on how do we create change and how do we help each other, and also defining what's acceptable and what's not acceptable. And as communities working together, we can truly create that difference, and we can promote that hope throughout all of the individuals that we are privileged to serve. FHN first responders such as fire, police, other paramedic, ambulance services, we are all one team where it comes to caring for our community. We're focused on working together to make sure that we're keeping people safe, and also making sure that when we recognize victims of violence, that we're connecting them to the appropriate resources to get help, and more importantly, to keep them protected and to make a difference so that they can focus on healing and getting better and making sure that our community is a healthier community overall. So we are all one team in caring for so many families throughout the areas that we serve. In the coming weeks, I hope that so many families throughout Northwest Illinois take time to really enjoy our area, support our local businesses, do that responsibly. Don't let life stop because of all of the things that are happening around us. We have so much to be grateful for. There is so much good in this world. We just need to stop, recognize, and celebrate that. Not to get fixated on events that are happening around us or even in our community, but being safe, being peaceful, and of course, always supporting local. Enjoying the beautiful area that we have and all that we have to offer. It's truly a blessing to be able to live in this area.